It might not be ADHD. You might be living out of purpose with your life and you're just not interested. I found this 17-question diagnostic that doctors give to their patients to see if they should be on ADHD medicine. Listen to some of these questions. How often do you make careless mistakes when you have to work on a boring or difficult project? How often do you have difficulty keeping your attention when you're doing boring or repetitive work? How often do you fidget or squirm when you have to sit down for a long period of time? If you have a task that requires a lot of thought, how often do you avoid or delay getting started? How often are you distracted by activity or noise that's around you? I think that almost everyone that's a human being would be on this list. Of course, we're going to have difficulty paying attention when it's something that is boring or we're disinterested or it's repetitive. This was made for factory workers 80 years ago. This is not where we live anymore. We need to move our bodies. We are meant to be active human beings. We're used to physical labor in the past, and since we don't have that anymore and we're sitting at a desk all day, we get fidgety because we're supposed to be moving. When we're starting something new, we often don't know where to begin. It's challenging, it's difficult, so we feel a little stuck. These are normal things. And when we hear distractions and things in our environment that pull our attention, that is a normal safety and survival mechanism to pay attention to your surroundings so that you don't get eaten. I'm like, what? This is what being human is. So more importantly, ask, are you doing something that feels purposeful in your life? Do you dread getting up and going to work each day? Are you doing things that are interesting to you or utilizing your best skills and assets so that you're engaged with what you're doing? If you don't know how to start, just Google or go to ChatGPT and say, hey, this is a project I'm working on, outline some of the details and say, what's a great way to begin? You'll get 10 options right there. I have a bunch of other tips and tools in my newsletter. If you want me to send that, just DM me your email address. And I have about 10 different tips I can give you about moving beyond procrastination into action. And if you want to work with me one-on-one so that you can actually get out of bed with excitement and doing purposeful work that feels aligned with you, then reach out and we will do a consult and see what it would look like to work together. What do you think about these questions that are asked in that checklist? Should we all be medicated?